Welcome to Coffee and Conversation podcast. I'm Patrice Tevis, a licensed and marriage family therapist. Today I'm meeting with Black men in our community talking about issues that plague our community. Today we're talking about Black men and their health care. We know that Black men have the worst health, among the worst in the United States in terms of health care. And what I want to talk about today is what we can do about it. So gentlemen, I want to talk about the issues: diabetes, high blood pressure, heart disease. What are we as Black men and as leaders and as role models, what are we doing about our health care? What can we do better? But first, I'd like for our panel of role models to introduce themselves.
My name is Maurice Geddes. I'm also a licensed marriage and family therapist, and just really happy to be here, part of the panel.
Thank you. I'm Jamal Rowe, father, husband. All right, and not in that order. It's actually husband, father, son, all the good things that go along with that.
Keon Johnson, brother Keon in Community, founder, operational YMO, Yours, Mine, Ours, family man, community advocate. Yeah.
Mr. King, CEO, executive director, founder of the Gardens Family Care Community Center. 22 years providing services within our community around health and wellness.
So, gentlemen, if we have the worst or among the worst healthcare in America, what are we not doing?
Can I respond to that?
You may.
All right. There is a stigma in our community that we as Black men, we always have to be strong. We always have to show up as being not vulnerable. We have to show up a certain way in our communities in order to what's wrongly we perceive to gain respect. So while we are in that position to have to hold that place, to hold that space, in that, what I call a facade, we're not paying attention. We do not want to lend that attention to the fact that we're not impervious. Yeah. We are susceptible to disease. We're susceptible to the elements. We're susceptible to all those things. So in our communities, one, we hear about it all the time, but at the end of the day, what do we do about it? It can't be just about, diabetes and high blood pressure. There's something that's going on before we even get to that conversation.
And I think that thing that's going on is we are at the bottom level, we're not responding to our bodies, right? We're not responding to what we feel. We're not, like you said, we just keep on going. We just keep on pushing. I think we are not informed, if you could just baseline, we're not responding to ourselves and what we feel, and we're not informed.
What about trust?
Picking on what Dr. Geddes said, is that we feel that macho-nism, that we have to just be the superhero. But my thing is we have to start getting that trust and getting educated about preventative care. We can't wait till the stroke is already on us. We're already a full-fledged diabetic before we start worrying about having diabetes. We got to try to find resources to get preventive care before we get to that point. Because we're dying, folks. I'm telling you, Black men are dying young.
So in history,
Yes, I'm glad you brought that up too.
yeah. So history plays a part in everything. We have to go back, right? And looking from my vantage, I think if I go back, I don't know, let's say 50 years, what did the healthcare system look like for us in the neighborhoods that we were raised in? Obviously, 50 years ago, I wasn't here, but those type of neighborhoods. Was there trust in going outside of that neighborhood to go to some building and be told whatever it is that you're told? Or, and I think the answer is no. I don't know if there was a trust. There was nobody looked like us, no representation. So it developed a lack of trust in the people that had the education to do, whatever the diagnosis was.
So my question would be, how do we advocate for ourselves? And how do we help each other? Mr. King talked about education. How do we educate each other in our community to start believing in healthcare? in the way that we can now.
I'm gonna say black men talking. We need to start having conversations in our barbershops, our hair salon, wherever we gather as men and being leaders, supposed to be leaders. We need to have these conversations. We need to grab our young brothers. Brother Keon, I need you to take care of yourself, brother. I love you. I want you to get checked. We need to have those resources, like Brother Jamal say, trusting resources that we can get and find people like Dr. Geddes and yourself that's in this field that look like us that we can trust to educate us about those kind of services that we need and those resources.
Well, something as simple as one of my buddies told me when I turned 40, I was driving to go get some donuts, and he heard me on the phone. He's like, "You getting donuts?" And I was like, "Yeah, I'm getting a donut." And he's like, "Bro, you're 40 years old, man. Trying to put that donut away." Yes. Like, it was a joke, but it still, to this day, has stuck with me. Like, yo, I need to stop eating the donut. Right? Like, just something that simple that I'm going to listen to him because it's my friend, right? I'm not going to, take it any type of offensive way. But if I see you eating something that's crazy, I'm like, "Mr. King, what you doing? It's 7 o'clock in the morning, bro. What are you eating that for?" Like, those type of discussions, those type of internal checks are necessary because
it is practice and it is lifestyle.
It is lifestyle.
I was just going to say that.
What are we not doing, right? We're not focused on
Lifestyle and choices, right? And health maintenance, basic things like exercise. Don't overeat. Don't eat fried foods or over salty foods and those sorts of things. Or
It's
eat
hard,
less.
but
Eat
Well,
less.
and that those all make sense. Those are all very, very true things that we can put in place. I love Mr. King. I love y'all, but I love Mr. King because he always calls me Dr. Geddes. I'm almost there. I'm almost there, guys. I'm finishing up my research for my PhD in performance psychology. And one of the things that I've learned in that process is there's in performance, even in what we're doing here today, there is a deeper place that we are pulling from. And it's coming from how we view ourselves, how we feel about ourselves, how the world perceives us, and how we perceive ourselves in that world. And I think when we start to talk about those things, then we can make that bridge, we can make that connection. We can transfer what we learn from in that discussion to our health.
That's true.
But I just think because we have to bridge that gap quickly because we down out there so rapidly. I mean, I'm looking at statistics and numbers. I'm talking about it's like, and the part that gets me the most and what concerned me the most, we're dying so young. I mean, we're not even staying old enough to watch our kids graduate, to watch our kids go off to college or fulfill their dreams. It's kind of sad when parents die before kids because we're not taking care of ourselves. We got to have these conversations about health and wellness and even mentally, spiritually, and psychologically. We need those conversations. And you always going to be Dr. Geddes to me. You might not have that paper, whatever, but the work that you do,
right.
you're a doctor to me. I heard you.
What about also, you got to join the club, if you will. So I think a lot of times if we want that type of representative to care for us, we also have to educate ourselves to be that doctor or that whatever it is that you're trying to do, because a lot of times, like, you go to the hospital, there's implicit biases that go along with the diagnosis as well. Could be.
Absolutely.
So, I could come to the hospital with a rash and somebody might think it's whatever, full-blown AIDS, or really I just need some hydrocortisone. Or somebody else might go, similar circumstance, and it's hydrocortisone for them, right? But how I might live is just I'm different. So the implicit biases play along in every facet of life to include the doctors, right? So how do we involve ourselves in those conversations is having other doctors that look like us in the room with them.
Well, I want to just interject. First of all, we can question doctors in an appropriate manner. We can ask questions. We can have a conversation. We don't need to just sit there and not understand what's happening.
Yeah.
But it starts with maintenance. It starts with if you get diagnosed with high blood pressure, take your medication.
Yeah.
How about that?
Wait, because that was me, and I was on the verge, and I started doing some other. I went back, but the numbers went down since. But here's the thing, like that, the first thing they do is they just want to give you drugs, meds. I learned that, and then on the back of the high blood pressure medicine, first off, the pills was making my some dry cough I've never had. It was terrible, and I didn't realize it was the pills. And then one day I finally decided to read the thing again. So that's where that goddamn thing is coming from. You know what I mean? It was very uncomfortable. It tells you don't eat grapefruit. In the natural world, they tell you eat grapefruit to get your blood pressure down. Drink hibiscus, drink beet juice, and exercise. But what they want to do is just put you on these meds and tell you, well, you know, it's very hereditary. We inherit lifestyle
Sicknesses
and diets. You know, it's in your diet, it's in your lifestyle. They tell you it's your people and your blood. No, it's not necessarily that. But the idea that the pills would tell me don't take grapefruit. When I do my research, it tells me eat grapefruit.
Right. So you're saying that you were diagnosed with high blood pressure. At first, you didn't want to take the medicine.
No, I was taking that first.
You were taking it, then you stopped.
Hell yeah.
Then you found other ways to, in other words, combat or
yeah.
fight
And then taking the pills, I
issue.
gotta still do more because it involves a healthy lifestyle,
Consistently.
exercise, consistency.
Yes.
Right. So I started a fitness group. You know what I mean? So that helps me to my own accountability. You know, it's black men working out. We in the park every Saturday. You know what I mean?
That's
me
good.
working on that, and I do my own little thing. The part you said about questions though, like when we was having my child, the doctor looked at my lady and said, "You know what? You ask great questions." And every time we go to the hospital for anything, whether it be the children, whether it be herself, you ask great questions.
See, that's the new norm, though, for us having access. Some of us, a lot of us, having access to medical care and treatment. Jamal asked a question earlier. 50 years ago, I remember when I was a kid, my dad never went to the doctor or the hospital. He just didn't do it. I saw my mom go. We went. But I never saw him until he got into his 50s. And then he started going a lot because he got diagnosed with diabetes. But prior to that, it was, and the one time that he did go that I recall, I'm like, my dad's going to the doctor? I thought he was like invincible.
And he was. He just got old. He didn't even go. Because look, didn't nothing happen to him. He was good until he started going, right?
Exactly. So
he was all right.
That's a word.
before we run out of time, I just want to know the things we can control. There's a lot we can't, and there's a lot we're not going to be able to control in a lifetime. But what can we, well, you all, as black men in the black community, do to, like, you know, self-care is healthcare. You know, those sound catchy, but they're real. What can you do to prevent and live longer with some of these conditions we're talking about?
I cook your own food.
That's one.
I
That's
love
also
it.
So we have to
consistent.
recognize the layout of where we live. Maybe depends on where we live. So the food, the options that are around. I've learned to stop putting myself in situations where I'm consistently hungry. Because then, if I get in these certain areas and I'm consistently hungry, there's the options around are few and far in between, and they're probably not good
Fast
for me.
food,
Right,
junk.
it's probably not good for me.
Right.
So having some healthy preparation.
So it would require maybe a different lifestyle. I know that I talk to Mr. King from time to time, and he's on his way to the store to get something for soup and a salad. I'm like, man, you always eating vegetables? He said, not always, but he has incorporated that consistently in his diet.
And I have a little garden. I grow my own fresh vegetables, corns and salads and cucumbers. And I grew up on a farm, so I try to eat healthy as I possibly can, especially getting older. So one of the things I try doing, even talking to other people, is about, you know, eating more healthier. I mean, you can't, at getting 60 plus years old, you can't live off of fast foods and eating late at night and fried food. It just don't work.
I'm glad you said, like, grow your, if you afford the opportunity to, right? When you said cook your own, I'm like, that's perfect. But if you can grow your own, so I'm glad you used that as an example.
Put it together.
Right, and do that. But it's really about being informed. You know, that's another thing we could do, is really try to be as informed as we can. Because as it pertains to the healthcare system, you know what I mean? When you look at the industry that it is, it's really It's not a healthcare system.
I know.
It's
It's
not a
it's an
healthcare
industry. It's
system.
another industry that makes money.
It's a money maker industry.
And I want to piggyback on what Keon said, and that is the exercise component to it. So I'm 60 plus. I'll be 63 next month. So I still run. I still play basketball. Still play racquetball.
Yes, sir.
I'm at the gym.
You still try golf?
Still play golf.
Try golf. He said try.
I do all those things. I do all those things. But it's important not just for the physical part. It's my mental maintenance
So
as well.
before we wrap up, because I don't know what our time is like, I think we might be running out of time, but we're talking about a lifestyle change.
Yes.
We are absolutely talking. That's something we can do and we can incorporate in our homes
Yes.
and in our communities. And then we're just talking about getting the word out, because I do believe that our death rates are increasing, and we can slow them down by taking control of the things we can and having these conversations that we are not invincible. There's really no Superman. That was a myth. And we need Black men in our communities, in our homes, in our lives. They are the leaders of our community. And if you're not here, it can't happen.
That's right.
So what I want to say is thank you all for participating in this conversation. And I would love for us, Black men, I would love for y'all to keep talking.
Black men talking.
Black
All right,
men
Black
talking.
man talking.